Hello and welcome to Let's Talk 901 with Betty Lamar, the show where we talk about healthcare, health and social disparities in Memphis. And we thank Ms. Lamar for all that she's done for this community, for this state, for this world, to make this world a better place. I'm Dr. Chuck Lester. I'm your guest host for today. We're kicking off Cancer Awareness Month. And I want to talk to you today about encouragement, about breast cancer, about things to do and not to do. And I have a guest on the show today that has a testimony, that has lived through it twice and will help me out here on today. I have none other than my wife, Dr. Deneen Lester. She's a retired City of Memphis employee. She works now as the Executive Director of Human Resources for the Salvation Army in Memphis. And she's the host of Let's Talk HR with Dr. Deneen. She is here today. She is a two-time, 26-year breast cancer survivor. Dr. Lester, welcome to the show.
Well, thank you so much, Dr. Lester. Thank you for having me.
This is a little different today, huh?
This is different, but it's gonna work.
And we both thank Betty Lamar.
we thank Betty Lamar.
Yes.
Yes.
So let's dive right in. 26 years
Yes.
as a breast cancer survivor, and you've had it two times.
Yes.
The first time, 26 years ago.
Yes.
You must have been pretty young. Tell us about it.
Well, I was 35 years old at the time, and I was in the shower, and I just happened to feel a lump that felt a little bit different than just normal tissue
Yes.
in my breast. And I felt that lump, and I went to the doctor, and they said, well, we're going to do a biopsy on it.
Okay.
And they did a biopsy, and it came back as cancerous, came back as malignant
At 35 years old.
at 35 years old.
And did you go into the office to get the results from the biopsy? Did you get it over the phone? How did you get the results?
Actually, they called me over the phone.
They called you over the phone?
Over the phone,
Okay, so you're 35 years old.
yes,
You jump in the shower. You feel a lump.
yes,
You call the doctor. They call you in. Do a biopsy. Send that off. Get the results back. Call you in, or call you on the phone.
on the phone,
On
yes.
the phone. And say, we're sorry to tell you have breast cancer. How did you feel? 35 years old.
The first reaction was devastation.
Yes.
I was 35 years old. Didn't think it would happen to me, but my family had a history of it. My great-grandmother and all of her daughters died of breast cancer.
Okay, actually passed away from breast cancer.
Yes, they did.
Your great-grandmother and all of her daughters.
All of her daughters.
Wow.
Yeah.
And so you get this news now that you have it.
Yes.
So with that thought, knowing your family history is crucial.
It is.
Your family medical history.
It is. You should know it so you can be prepared or looking or be on the lookout for it. You should know your history. Because at the doctor, they're going to ask you that.
They're going to ask, right?
Yes. After you are diagnosed, they're going to ask you, were there other family members that had breast cancer? So I had to call the roll.
Right.
And then it gives the doctor, it gives the physicians, it gives them a little bit more information of what to work for.
And I guess
what to look for.
that's so important because a lot of people don't know that family history.
Yes.
A lot of people in families may keep it secretive.
Yeah.
You know, well, I don't want people to know. I don't even want certain family members to know. But you're telling us that your great-grandmother and all of her daughters died from this disease. And now you have it.
Yes.
You know, you're 35 years old. And let's go back. You said you were in the shower and you found a lump.
Yes.
You noticed a lump and you paid attention to it. In my mind, I'm thinking now self-examinations.
Yes.
How important are they?
It is so important. But mine wasn't a self-examination. I just happened to feel it.
Okay.
I happened to feel it. But that is so important. And to know your breast and how they feel.
Okay.
Because the lump, it was very hard. So regardless to how I touched it, it felt very hard. It was like a knot.
Okay.
And so It was concerning at the time. So at that time, that's when I said, well, I better go to the doctor.
Okay. And so yours wasn't actually an examination, a self-examination. You just happened to feel it because it was hard.
Yes.
Okay. So are there times, and I'm a guy, so I'm asking, are there times when women may not have a hard lump, but there may be something there? And how often do you need to do self-examinations anyway, even if you don't feel anything?
Yeah. So I think what should happen is that you pay attention to how your breasts look.
Okay.
And if there's some changes, if you see changes,
Okay.
slumping, or something that wasn't there before, a month before, 2 weeks before, you know,
Okay.
a day before, pay attention to that. But the self-exam is a way in which a person can do something on a routine basis.
Okay.
Right?
And self-examinations are not, from what you're telling me, are not just physical, but they're also visual.
Yeah, visual and visual and
And
also,
physical.
yeah, physical.
Okay. So 35 years old. Now you know you have this disease.
Yes.
Where did you go from there?
After that, I was diagnosed with the malignant cancer. So the treatment was 3 months of chemotherapy and 6 weeks of radiation. And they gave me the strongest chemotherapy because I was so young. And they called it the Red Devil.
The Red Devil, because
Yes.
it was so strong.
Because it was so strong.
Okay. We'll talk about the chemo, but let's go back. You used the term that I
Yes.
think everybody should know, malignant. Tell me about that term.
So what that means is that there's actually cancer in what they found from the biopsy. And in the biopsy, they take a needle and they target that area and pull out liquid from that area
Okay.
and send it off.
Send it off to a lab to get tested.
Yes, and it comes
They find
back.
out. Okay, so if it's not malignant,
It's called benign.
benign.
Yes.
Okay, so you have malignant tumors and you have benign tumors.
Yes.
Malignant means that there is cancer.
Yes.
Benign means that there's not.
Right.
So if we find a tumor, we want it to be benign.
We want it to be. We want it to be
if we
benign.
just have to have one.
Yeah.
We want it to
if
be
you
benign.
got, yeah. If you got
just
to
have
just
to
have
have
one.
it.
Yeah.
Wow. This is amazing. So you go through chemo. You're taking the Red Devil.
That's what they called
They
it.
called it the Red
Yeah,
Devil
because it was so strong.
because it was so strong, and they gave this to you because you were so young.
Yes.
You were 35 years old.
Yes.
How did you handle that? How did chemo affect you?
Well, it was
Did you lose your hair? Did you feel fatigued? Tell
Yeah.
us about that.
So you lose every strand of hair that you have on your body. Let's put
Wow.
it that way, right? Hair, eyebrows, everywhere else. Yeah. And so for me, it was like the first 2 days after taking the treatment, I felt sluggish,
Yeah.
tired. But then all of a sudden, third or fourth day, you're back to where you are.
You told me you would take yourself to the treatments.
Yes.
And
Yes.
then you would go and eat lunch.
Let me tell you, I went to Houston's restaurant.
Okay.
Every time. Every
Okay.
time. But I knew in that second day
That
I would
second
feel sluggish.
Okay.
But I was not going to let the disease beat me. I still believed that I would go eat my lunch as usual. Yeah, I'm going to move forward. I'm not going to look back.
And so, losing the hair.
Yes.
A lot of women would have problems with that. How did you handle losing your hair?
Well, let me tell you, I had a friend, and she's deceased now. But she said, well, listen, one of these things, she would always wear hair extensions. And she said, we're going to try hair extensions. She said, well, one you pull on, which is a wig, and one you put on, and then one you pull on.
Okay.
But I had a great support system of sister friends
Okay.
that supported me through that. And I was a new woman every day. I'm every woman, a new lady every day because I had a different wig every day.
Okay.
Right.
A new lady every day. So
new lady.
you were actually creative with it.
Yes.
Okay. Well, you know what? We'll talk about that a little bit more. And you mentioned having a support system.
Yes.
We'll talk about that a little bit more. We're going to take a little time and take a little break here and just come back with more of Dr. Deneen Lester on Let's Talk 901 with Betty Lamar. This is amazing.
Good evening. My name is Charles. Welcome to the Medical Class 901. Be sure to stay tuned for Let's Talk HR with Dr. Deneen at 8 p.m. immediately following Medical Class with Dr. Chi on this channel. An HR director is the person who oversees all things related to the employee life cycle and workplace culture. Their job is to create a people plan that will support the delivery of your strategic business plan, ensuring your team is happy, motivated, and working well together. An HR director helps build your employer brand and employee value proposition to attract and retain the right people and help make your business an attractive place to work through reward, recognition, and development processes. HR directors help bring in the right people to the right roles to support growth. Tune in next for Let's Talk HR with Dr. Deneen, your go-to for all things related to level up your human resources journey.
Welcome back to the show. Welcome back to Let's Talk 901 with Betty Lamar. I'm your guest host, Dr. Chuck Lester. My guest today is my wife, 26-year two-time cancer survivor, breast cancer survivor, Dr. Deneen Lester. And Doc, we left off with talking about the hair and talking about being creative. I've seen people go into just really seclusion because of the loss of hair. I've seen people not want to go out. I've seen people wear scarves, but then I've seen people just say, hey, it is what it is. But then I've seen people like you who say, I'm going to be creative. I'm going to be whoever I want to be on this day.
Yes.
Tell us just a little bit more about that. What would you say to a woman who's about to go through chemotherapy and they've told her there's a good possibility you may lose all of your hair?
Well, I think at that point, I think you would need to just wrap your mind around it and go and do the best solution that's going to be best for you. Just like you said, some women get different wigs, and I was the wig woman because I was a blonde brunette. I was everything, right?
Yeah.
Some women just use the scarves. They have scarves that are very fashionable. And some women just decide to say, hey, I'm just going to wear loop earrings and I'm just going to wear my baldness, right?
Yes.
So whatever is perfect for you,
Yes.
you make that selection.
And by the way, I can say this as your husband, you're an absolutely beautiful woman.
Well, thank you so much.
bless
Thank
you.
you so much,
Okay.
Dr. Lester.
So you also mentioned that you had a friend that said, hey, let's try this, let's try that. You mentioned support.
Yes,
And so you had a support system,
I did.
okay? 35 years old.
Yes,
You don't want to go through this alone.
yes.
Tell us about support systems. How important are they? Who could be in a support system?
Well, that could be anybody that is that's going to be really supportive of you and your journey. So that could be your relatives. It could be good girlfriends like I had. It could be, your pastors. It could be your church family. It could be your coworkers. Those that are going to be just close to you, understand your journey, and agree to walk with you in your journey.
And why is it important? Why is it so important to have a good support system during times like this?
Because you need that. You need that reinforcement.
Okay.
Yes, you need that encouragement.
Okay.
Because a lot of things are going on with your body.
Yes.
Remember, you've lost your hair.
And I'm assuming with your mind also, with your mental state.
And with your mental state, yes. I mean, all of these things are happening all at one time. And so that support system is the I guess, the entity that helps push you along, that cheers you on as you're going through the journey. So it's so important to have a support system in your life.
Wow. So let's move forward.
Okay.
25 years.
25 years.
25. You went 25 years with no issues.
No issues.
None.
None.
We've been married 13 years.
Yes,
Okay. So we thought that part of life was over.
we did.
But then tell us what happened earlier this year, 25 years later.
25 years later, February of 2025, I was just going for my routine mammogram. You know, I said, honey, I'm just going for my routine mammogram. Got there, they did the mammogram. I thought I was gonna get that little pink slip where they have the check off where it says, oh, you are great, we'll see you, 6 months or next year. But it wasn't. A doctor came into the room and they said, on the same side that you had the first breast cancer, we see another lump. We see another area that could be cancer. And so immediately they ordered the biopsy.
So how did you feel at that point?
I was thinking, why is this happening again?
Okay.
How can this happen again?
And so they ordered the biopsy.
Mm-hmm.
I drove you to the doctor's office.
Yes,
To get the biopsy.
yes,
You went in to get the biopsy. I went across the street and had breakfast.
mm-hmm.
When you got the results, when you received the results, how did you receive those results?
I received them on the phone. It's a phone thing, maybe,
Okay.
but I did receive them on the phone, and I was a little disappointed, but I had the faith. I had the faith that I'm going to make it through this journey too.
So 25 years later,
Yes,
you go in. And let's pause right there. You went for another mammogram.
yes,
It's so important to get the annual mammogram.
yes. Regular screenings.
Yes.
You should get those. Make it intentional to get it. Put it on your calendar, right?
And we were blessed. Now I'm going from you to us,
Yes.
to we,
Yeah,
changing the pronouns. We were blessed that this was caught early.
yes.
You waited a couple of days before you told me.
I did.
Why?
I'm going to tell you why, honey.
Yeah.
Well, first I had to wrap my head around it first.
Yeah.
Get my mind around it again, that there's a possibility I may have to go through all those steps. And then I wanted to do it in a setting where we were, everything was calm. I'm having to tell my husband that I have cancer. So I waited for a Sunday afternoon,
Yes.
and after dinner, after we'd eaten all of that good stuff,
She fed me well, and then she dropped this news.
I dropped the bomb on you. But no,
And-
all seriousness, yeah.
And just here, nobody knows this, but I was sad, I was upset, I was disappointed, I was furious, turned into anger. And not at you, but just at the situation.
Yeah.
Sometimes as a husband, well, all the time as a husband, you'd rather something happen with your body than your wife's body.
Yeah.
But once we got past that, we started talking about what could be next.
Mm-hmm.
What was next? I'll let you tell.
Well, what was next was we went to the doctor, and because the cancer was on the same side that I had radiation, they could not do just a lumpectomy and get that part out. Right. So they told me you would need to have a mastectomy on that one breast.
Now, they tell you don't always go to the internet, but you have a husband who's a researcher.
Oh, yes. Oh,
So
yeah.
I went to the internet and I found, and I said, this is what they may say. I'm not a medical doctor, but
Yeah.
this is what they may say. And we actually had it in our minds ahead of time.
Yes.
Did that help?
Yes, it did. It did so much. We had it in our minds.
And how did that help when the doctor came in and you already had some thoughts on this is what the doctor may say?
Well, it kind of prepares you ahead of time, and you can prepare questions for the doctor, right?
Right.
Because you've had some inkling of what the doctor may say or what the science says about the situation.
And the doctor we're talking about was actually a breast surgeon.
Yes,
This wasn't the primary care physician.
Right.
This was not a regular oncologist because we knew the cancer was there, the
Yes.
cancerous cells. So this was actually a breast surgeon.
yes.
And would you like to share what the options were? Or what?
Well,
what
the
they
options
told?
were to get the one side taken off and have reconstructive surgery. But you know what? I said, and we thought about it and we talked about it together, because when you're a couple, when it's husband and wife, you need to talk about this together because it impacts him too, right? And so, the other option was to just do what is called a bilateral mastectomy.
Right.
And then that takes off both of them, and then you don't have to worry about that anymore. And so that's what we chose. We're going to take off both of them. And we don't have to worry about that anymore. And they would do reconstructive surgery to give you some new girls.
Right. And they did it the same day.
Yeah.
The same day as this. That's what a lot of people may or may not realize, that this can actually be done the same day. The same day. And the other option was to actually have the breast removed and just have a flat chest, which a lot of women are doing now, and there's nothing wrong with that. We chose the reconstructive surgery.
Yes.
And if I could just pause and say to husbands and significant others and brothers and all the guys, the males, that the support that your wife, your girlfriend, your sister, your mother, your niece, your daughter, whomever may need, is so important from you. It takes a lot of understanding and a lot of prayer. But when you think about it, I would rather have had you here than anything else.
Yes.
And so I think that when you talk about things, and you can add on to this if you like, when you talk about things as a couple or with someone, and you're just open and honest, yeah, I'm a little angry, and this is why I'm angry. It's not at you. Or these are the options we have. I think this would be best. I want to see you around here when we're 95 years old.
Yes.
105 years old. We want another 30 years.
Yeah.
That's so important.
Yeah.
So we go, and now we're ready for the surgery.
Yes.
We've made our decision. And we're going to take a short pause, another break. We'll come back, and we'll talk about the surgery. We'll be right back with more of Let's Talk 901 with Betty Lamar. Special guest, Dr. Deneen Lester. I'm your guest host, Dr. Chuck Lester.
Good evening. My name is Charles. Welcome to the Medical Class 901. Be sure to stay tuned for Let's Talk HR with Dr. Deneen at 8 p.m. immediately following Medical Class with Dr. Chi on this channel. An HR director is the person who oversees all things related to the employee life cycle and workplace culture. Their job is to create a people plan that will support the delivery of your strategic business plan, ensuring your team is happy, motivated, and working well together. An HR director helps build your employer brand and employee value proposition to attract and retain the right people and help make your business an attractive place to work through reward, recognition, and development processes. HR directors help bring in the right people to the right roles to support growth. Tune in next for Let's Talk HR with Dr. Deneen, your go-to for all things related to level up your human resources journey.
And welcome back to Let's Talk 901 with Betty Lamar, where we talk about health and social disparities in Memphis. And again, Ms. Lamar is helping so many people, not only in Memphis, but around the state, around the country, and around the world. We left off. My guest is Dr. Deneen Lester. I'm the guest host, Dr. Chuck Lester. My wife, we left off, and we were talking about that red devil. And again, you were 35 years old the first time. You were still in childbearing years.
Yes.
And, we did not have children, but that wasn't the reason why. We just did not have children.
Yes.
But what are some of the complications, before we go into the surgery, what are some of the complications that could happen from the chemo?
Yeah. So from this particular chemo,
Yes.
it was called the Red Devil. It did throw me into menopause early.
Okay.
And so at that point, you're not able to have kids after menopause. So that was one of the effects, but that's the effect of that particular kind or type. It doesn't mean that that's the effect of every type
Yes.
of chemotherapy.
But there are other issues as well as heart issues, as well as just making you know, having fatigue all the time. Am I correct? Or
Yeah, in some cases, fatigue is one of those side effects. I didn't have it. He always tells me I'm on 10.
from the time she gets up.
Yeah, to the time, you know. But that was not one of them.
Okay.
Yeah.
Okay, but we just wanted to make people aware. These are some of the things you may want to ask your doctor. Is that correct?
Yes, yes.
What kind of side effects will this
Will that
cause?
particular
What
kind
right,
that
whatever
you're
kind
getting,
you're
yeah.
taking, what will there be any complications outside of losing the hair? We talked about that.
Yeah.
But then let's go into the surgery.
Yes.
We decided on the bilateral mastectomy, which is both breasts, the tissue out of both breasts removed.
Right.
And initially, you know, we were like, yeah, we may need to do this. We may need to go on. So you had the surgery back in May.
Yes.
How did you feel going into the surgery, and how do you feel now?
Well, you know, when I was a little apprehensive because I didn't know what it's going to look like. You know, we know that there were going to be reconstruction of breast, but after the surgery, I'm telling you, it wasn't a bad thing.
I'm happy.
Listen, you always said, if I have new girls, you have new girls.
Absolutely.
So, and they are new and improved. Let me just say that, new and improved.
So
yeah.
what you're telling me and what you're telling this audience is not the end of the world.
It is not.
And it's not the end of your everyday life.
It is not. It is not.
You're going to work every day.
Yes.
You're exercising. You're still singing choirs.
Yes.
You know, you're active in the community.
Yeah.
You're hosting your own talk show.
That's correct.
We never had to stop anything.
Yeah.
So this does not have to be, first off, it doesn't have to be a death sentence.
That's right.
It doesn't have to be a bedridden illness
Right.
sentence. I mean, you can live your life after this, and that's what you're doing.
Yeah. It is not the end. In fact, sometimes it's the beginning of something new.
Absolutely.
So it is the beginning of something new, new and improved, all reconstructed, all of those things in one.
Okay. And the healing process, was it terrible? Some people would think this would be so terrible.
Well, it was painful, but of course you had medication for that. You know, the doctors would issue medications for the pain, but it does kind of go away on its own. You know, you did have to have pillows, right? They have this thing called mastectomy pillows. So when I did travel, the mastectomy pillow, you put it on. So if you hit a bump in the road, it's not such a jar to your body.
And you did so well with your recovery. Let's take a minute. If you could say anything to anybody who's going through a breast cancer diagnosis, or even a survivor, what would you say? Let's close the show. I'll close the show afterwards, but let's hear from you. As a two-time, 26-year breast cancer survivor, what would you say to the female audience?
I would say keep a positive attitude, regardless to the diagnosis. Pay attention to your breast. Look at them. See if there are any changes, anything's going on. Regular screenings, right? Your diet has a lot to do with breast cancer as well. You know, plant-based foods are so important. And then, and this is what you're going to enjoy so much, manage stress and get enough sleep.
Absolutely.
He tells me I'm on 10 and I don't get enough sleep sometimes, but that is part of reducing your chances of breast cancer. Yeah.
That is great. That's great advice. And we want to thank you so much, Dr. Deneen Lester, host of Let's Talk HR with Dr. Deneen, for being a special guest on Let's Talk 901 with Betty Lamar. I want to thank you all for tuning in to the show. I want to thank Ms. Lamar for having me. I'm Dr. Chuck Lester as the guest host. Please join us on YouTube and on Comcast Xfinity for more shows. You can see us every week, and God bless you. May God keep you. Thank you so much.